Hormonal birth control has many uses, including the obvious of avoiding pregnancy. But what about when you are ready to start your family? What happens next? We sat down with Dr. Carolina Sweldo with the Women's Specialty and Fertility Center in Clovis to find out more.
So if a woman is trying to get pregnant, we finally stopped taking our birth control, what is the timeline of what we should expect to happen once that happens?
Yeah, so that timeline really varies patient to patient. For some women, as soon as they come off birth control, even within that first month, they may conceive. And that's going to really depend on the hormonal levels of the patient as well as other factors. The most important of those being age.
And does it matter how long you've been taking birth control before?
So we now have fairly good studies showing that the length of time that a patient has been taking birth control pills does not impact their ability to get pregnant. So even if they've taken it for 5, 10, 15 years, as soon as they come off of that birth control, their fertility should go back to baseline. Now, what may vary from woman to woman is that baseline.
And you're saying that age is really just the biggest factor. It's not necessarily how long you've been on the birth control.
Correct. So age, and by definition of the American College of OBGYNs as well as the American Society of Reproductive Medicine, we take the age of 35 as sort of this binary divider. So under age 35, we typically see women are still in their peak sort of fertile years, and then after age 35, we do start to see a progressive decline in fertility, and it can become harder for those patients to become pregnant. Now, there are other factors. For example, if the patient was placed on birth control for irregular cycles, for example, coming off of the birth control may return those irregular cycles due to hormonal imbalances. So there are other factors, but really the number one issue for an otherwise normal, healthy female would be age is the number one predictor.
So what should someone do if they're still not getting pregnant? So much time has passed. Where should they go?
So the definition of infertility really goes back to the length of time that the couple has been trying. For women who are under 35, we have good data showing that roughly 80% of couples will conceive in the first year. So if the couple has been trying for 12 months with timed intercourse and has been unsuccessful, that's probably a good time to start seeking medical advice. Now, that medical advice does not always lead directly into high-tech therapies like IVF, but definitely at the very least an evaluation would be warranted. For patients who are over 35, that timeline does get shorter, and we typically recommend seeking out a medical professional after 6 months of timed intercourse.
All right, very good information. We appreciate it, Dr. Sweldo.
Thank you.
Thanks.